Hello everyone, I'm Ran Huo, coming from Peking University Third Hospital. Today my presentation is Associations between carotid plaque characters and improvement of cerebral blood perfusion in patients with moderate to severe carotid stenosis undergoing carotid endarterectomy. Stroke is one of the leading causes of death in worldwide. Carotid vulnerable atherosclerotic plaques were one of the major sources of ischemic stroke. Cerebral blood flow (CBF) is one of the major indicators of cerebral perfusion. Reduced CBF were found in patients with carotid stenosis. Plaque characters such as the stenosis, APH, and calcification were associated with CBF. Carotid endarterectomy (CEA) was one of the main treatments for carotid stenosis. This study sought to investigate the relationship between carotid plaque characters and the preoperative CBF, utilizing MR vessel wall imaging following CEA. The inclusion and exclusion criteria of study population were as follows. Here are the parameters of MR imaging and CT perfusion protocols. We analyzed the plaque burden and the presence or absence of plaque component using Vessel Explorer 2 software. The CBF of cortical flow territory of the middle cerebral artery on both the index side and the contralateral side was calculated automatically. We calculated the relative CBF and the difference ratio of CBF. Pearson or Spearman correlation and linear regressions were used. A total of 131 patients were enrolled in the study. Univariate linear regression analysis shows that NWI was associated with preoperative rCBF, postoperative rCBF, and DRCBF. Stenosis was negatively correlated with preoperative rCBF. The associations of LRNC with preoperative rCBF and DRCBF were marginally significant. After adjusted for confounding factors, NWI was significantly correlated with preoperative rCBF. LRNC was correlated with preoperative rCBF and DRCBF. Here was a typical case. The images from a 48-year-old male patient who had plaque with LRNC in left internal carotid artery and ipsilateral decline in CBF before CEA and improved CBF after CEA. The present study shows the negative correlation between stenosis and preoperative rCBF and the positive correlations of NWI with postoperative rCBF and DRCBF, which might be contributable to the compensatory mechanism via the circle of Willis. Also, LRNC was positively correlated with preoperative rCBF and negatively correlated with DRCBF. Microdisruption and coexisting cerebral small vessel disease increase the demand for hemodynamic compensation from the contralateral side. The study also has limitations. The volume of a plaque component and the status of a collateral pathway of circle of Willis were not analyzed. It was concluded that carotid plaque burden and the component, particularly LRNC, might be effective indicators for CBF change after CEA. Great thanks to my teachers and classmates. Thanks all. Welcome to Abstract 27 for further discussion.